A patient walks into the emergency room after a snake bite. Vitals normal, no bleeding, no ptosis. Now tell me honestly, will you give ASV or not? Because one wrong decision here can either kill the patient or kill the kidney or kill your career. Let's break this case like a real emergency doctor. Hi, this is Dr. Samrat. As usual, I am back with real emergency case scenarios which we see regularly in ER. Snake bite to right ankle, 1 hour back. He is walking and talking. BP normal, pulse normal, oxygen saturation normal. Now, the relatives brought the patient to the ER. The relatives are shouting, Doctor, give ASV. Snake bite means ASV. Why you are not giving ASV? But in emergency medicine, no emotional drama. Listen carefully. Every snake bite is not poisonous. In India, 30 to 50% of snake bites are dry bites, no venom injected. If you give ASV blindly, anaphylaxis, serum sickness, renal injury, ICU admission, and unnecessary risk which may lead to till death. So our first job is not to give ASV. Our first job is to prove information. When a snake bitten patient looks stable, I ask four simple questions immediately. Question 1. Local signs. Is there progressive pain? Number 1. Is there swelling spreading? Is there blistering or necrosis? Minimal pain with no progression is suspicion for dry bite. The second question which I ask is look for bleeding. Any bleeding from bite site? Any bleeding from IV line? Any bleeding from gums? Any bleeding from nose? Any bleeding from orifices? Any bleeding from urine? If no bleeding, good sign, but not enough. I'll go for question number 3, which are neurological signs. Ask the patient whether he is having any double vision, difficulty opening his eyes, difficulty swallowing. Early neuroscience are subtle. If we miss this, patient will crash later. And I look for the fourth question, time since bite. Yes, less than 6 hours, symptoms may not have started yet. So, stable now does not mean safe forever. So, we have to see the case and observe. Now comes the most misunderstood test in India, 20-minute whole blood clotting test. For a fresh venous blood, clean dry glass test tube. Leave undisturbed for 20 minutes. No shaking, no plastic tube, no shortcuts. If blood is liquid, coagulopathy present. Venom proven. If clotted, patient may still be innervated neurologically, so don't relax. The biggest mistake which we do is whole blood clotting test normal, so doctor sends patient home and the patient might return at midnight with neurological or hematological manifestations like ptosis, respiratory failure, or bleeding manifestations. That's why observation is very important and the patient should be kept in observation. Stable snakebite patient must be observed. Minimum observation is around roughly 6 to 8 hours for suspected dry bite. If the bite is more than 24 hours and confirmed inflammation but asymptomatic, monitor vitals, urine output, repeat whole blood clotting test, neurological examination every 2 to 4 hours. Now the main question, when to give ASV, the anti-snake venom. Let me be very clear. ASV is given only if abnormal whole blood clotting test, progressive swelling, bleeding manifestations, neurological signs, and systemic symptoms. Stable patient alone is not an indication. ASV is an antidote, not a supplementation or a vitamin. So be very cautious. So what to tell to relatives regarding ASV? Because every relatives they will be continuously questioning why you are not giving ASV, why you are not giving ASV. So we can tell them relatives pressure is very real. Tell them one sentence. Right now your patient is stable. If venom symptoms or signs appear, we are ready to start anti-snake venom. If we give ASV unnecessarily, it can be very dangerous and it leads to any anaphylaxis and patient may deteriorate. Most families understand when you explain calmly. Remember this line forever. In snakebite, observation saves more lives than ASV. Emergency medicine is not about rushing, it's about right decision at the right time. In our next video, we will see snake bite with bleeding manifestation. That's where the most doctors panic. Subscribe, share if you feel it helped you because the next snake bite may walk into your ear.